With the fading fortunes of the Greenwood Leflore Hospital, the closing of the Neonatal Intensive Care unit in Greenville, and other events, politicians in the Delta have increasingly turned their attention to health care. So it's no wonder the topic has become a big campaign issue in the current governor's race.
I urge the legislature to think outside the box when it comes to improving Mississippi's healthcare system. Don't simply cave under the pressure of Democrats and their allies in the media who are pushing for the expansion of Obamacare, welfare, and socialized medicine.
It's not just Democrats that point out Mississippi could get an abundance of federal aid money if it expands Medicaid to the working poor. Governor Reeves says he's dead set against it, but not his challenger, Presley. Would you expand Medicaid?
And first day.
Really?
First day. Yeah, I mean, this is the dumbest thing we've ever seen. First and foremost, the legislature, as I mentioned, put $108 million, I think, into this hospital grant program. Mm-hmm. That's state taxpayer funds that was put into a program that could have been leveraged for another $900 million to really fix the problem.
He says expanded Medicaid would give failing hospitals a fighting chance, or at least give them some more time to adapt. Reeves says the answer should come from the marketplace and not from the Capitol.
Instead, seek innovative free market solutions that disrupt traditional healthcare delivery models, increase competition, and lead to better health outcomes for our fellow Mississippians.
And while that may sound good to a lot of people, Presley points out that if healthcare companies won't come to Mississippi because there's no money in it, things in his view will get worse.
Say no to federal dollars. Who in the world would come to a state that's bleeding money and hospitals are set to close at a time in which we need those funds here? So how do you make a business case scenario to attract healthcare companies when we're turning down healthcare funds? And they're looking at, well, wait a minute though, but they're also looking at the other hospitals in the state that are on the brink of closure. That's not a welcome mat for healthcare providers to come to the state. That's more like a warning sign bridge out.
Reeves seems to suggest that in today's fast-changing healthcare landscape, maybe companies don't have to physically come here.
There was a time when if you needed medical services, you had to go to a large brick-and-mortar hospital. That was your only choice. But today, people are increasingly choosing new healthcare distribution channels over your traditional hospital. Today, people are accessing healthcare through telemedicine providers, through micro-hospitals, through urgent care facilities, and expanded care opportunities with nurse practitioners, pharmacists, and others.
Will that be enough to keep people healthy? And can our ailing hospitals limp along to make it to that future? Those are questions the voters need to ask themselves. Dennis Turner, the Delta News.